What if Radiesse is injected in a fat pad, and that fat pad is enlarged due to it? This is a continuation of my other question, and I have done some research, and I think I found which part under my skin is larger after Radiesse. It's the jowl fat pad on one side of my face. So since Radiesse causes collagen stimulation, I think it enlarged this fat pad. It's harder than the other side, and I can feel it under my skin as a sort of big lump. Is this possible? And when it's a fat pad, does this also fade away? Or is it going to get smaller?
Thank you for your question. You've described in your question that you underwent Radiesse injection, and it appears that the Radiesse injection has become collected inside the jowl fat pad, as you describe. And you're concerned that it has caused enlargement of the fat pad as well, and you're asking what are your options based on the possibility of Radiesse causing collagen stimulation. Well, I think it's very important that you understand some basic concepts and ideas before you draw that conclusion definitively. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I perform a lot of facelifting surgery. I do a lot of injectable fillers. I have a lot of experience with most of the most popular injectable fillers, and I can certainly give you some guidance as to what I suspect may be an issue in the absence of photos. So to begin with, let's just start with what you originally went for. And I'm assuming that your goal was to improve the appearance of a jowl by blending the jowl with the jaw using a long-lasting filler like Radiesse. I suspect that's what you wanted to do, and certainly that is possible. When typical fillers like this are placed under the skin, there is an issue with the tissue integrity of the skin and how that filler eventually moves in a way that blends with the rest of the skin. So the question that I would ask is, how much volume was placed? When we're talking about injectable fillers, they always seem like the terminology is large, such as X number of syringes. I had 1 syringe, 3 syringes. But the volumes are often relatively small. You're dealing with typically milliliters. With Radiesse, it could be like a 0.8 or 1.6 milliliter volume. Now, Radiesse, which you probably already know, but just for clarity, is a suspension of a material called calcium hydroxyapatite. The intention is that this material would last longer than hyaluronic acid fillers. My concern about a material like this is, unfortunately, that if you don't like the way it looks, you can't really dissolve it. You can't remove it. In our practice, for similar scenarios where someone has a little bit of jowling and isn't quite ready for a facelift or isn't a good candidate yet for a facelift, we do something called structural volumizing. What I'm doing with structural volumizing is placing a longer lasting and thicker hyaluronic acid filler, such as Juvederm Ultra Plus as well as Juvederm Voluma, at the deeper level below the muscle. So understand that while fillers are generally placed at the skin level or right below the skin level, what I do is actually I place it at below the muscle level against the bone. Because when you think about it, and just understanding a little bit of anatomy, a jowl looks prominent not only because the skin and fat has descended, but also because there's an area right in front of the jowl called the mandibular notch. And this notch is an indentation in the bone that becomes accentuated with aging. So a lot of times I'll actually add volume there, and it might have been the intention of your doctor to place that material in front of this area. in terms or at the area of the mandibular notch as opposed to the jowl. It's possible that it may have migrated to that area. Now, that being said, it may not be so much the collagen stimulation that is responsible. It could be the physical weight of the material that may be causing the jowl to look enlarged or descended. It could be actually the laxity of the skin as well. These are technical issues that require physical examination. That being said, it is certainly something to at least approach your doctor about and ask about what's transpired. Typically, a doctor who's placing an injectable will have a plan A and a plan B in case a patient is not happy with that injectable treatment. But I would suggest that moving forward, if you have significant enough skin and jowl laxity, then you may want to consider a procedure like a limited lift or structural volumizing to restore at a deeper level the volume, and using a filler that can be dissolved. That's the big advantage of a hyaluronic acid filler that I didn't mention. I can take an enzyme if for any reason someone has an undesirable result, and I can dissolve the material. Radiesse, you can't really do that. Now, there are ways to manage radiesse, but it doesn't involve dissolving. And because it's calcium hydroxyapatite, the material actually lasts a fairly long time. So there are options such as imaging to see the material. There are definitely ways to approach this, but I think learning about the volume and having your doctor work with you. Sometimes when people are not happy with the way a certain area looks, often it's not subtraction that makes a difference. Sometimes it's addition, placing other material in a different way to blend these areas. There's also options such as tightening procedures, whether it's non-surgical tightening with a thermal energy device. In our practice, we have a 1064 YAG that we're able to do without ablating the skin, heat the dermis and the deep tissue, similar to the way radiofrequency or ultrasound energy devices do, but in a way that's a little bit more gentle so that the tissue contracts a little bit more easily. So I don't think you have to be completely in despair about your outcome, but just have your doctor who placed it evaluate you, and if you're not comfortable with that, move on and meet with other doctors and get some opinions and evaluations. But understand the foundations of the anatomy so it makes more sense, and not just stay focused on just the materials and the perception of what went maybe in a way that you didn't like. So I hope that was helpful. I wish you the best of luck, and thank you for your question.